providing timely, relevant content to providers who care for children. Welcome to Pediatrics in Practice, presented by Children's Mercy Kansas City. Here's Dr. Michael Smith.
Our topic today is common orthopedic conditions and how to treat them. My guest is Polly Wimer. Polly is a pediatric nurse practitioner working with the orthopedic surgery team at Children's Mercy. Polly and the other specially trained orthopedic specific nurse practitioners see approximately 60 to 80 patients a week in the clinic. Polly, welcome to the show.
Hi, thanks for having me.
I find this topic to be very interesting, and I kind of just want to have you teach us, teach me and the audience. So let's just get right into it, Polly. What's the first orthopedic condition you'd like to teach us about?
So I'd like to talk about in-towing because that's my job, and I've been doing it for 20 years, and things have changed. Our parents used to think that we had to have special shoes and braces, but we've done a lot more studies now and found out that kids actually grow out of a lot of the alignment conditions that we see. The only things that we actually treat with casting or bracing is club feet. So we see kids at all ages from infants to 10-year-olds because parents are concerned about their feet turning in or out. And there's common conditions like metatarsus adductus is where their foot is curved, and we only treat those now if it's severe and like if it's not flexible. And then there's bow legs, which is a normal phase that kids go through, and there's some teaching that their legs should be straight by the time they're 2, but it's actually more like 3. And then they go through a phase from 3 to 5 to where they have knocked knees. And then by the ages of 6 to 8, they should have their normal adult gait.
Yeah. So help me to understand a little bit as a primary care physician or as a general pediatrician working in the community, when they see this type of presentation, what's your advice to them? And are there things they can do right there in the office to help the parents feel better? What do you think?
Yeah, it's mostly reassurance and educating the parents about what's normal. And usually there's some relatives or sometimes grandparents that are actually more concerned than the parents. So it's just educating them that the kids are actually going to grow out of it on their own. A red flag or a condition that we would, want you to refer to us is if there's asymmetry, because as they grow, they should be symmetrical. But if there's asymmetry in one foot or one leg that's different than the other leg, then that would be, something that you would want to refer to our clinics.
And when you see something like that in the community, what does that usually mean when there's asymmetry?
There's conditions that can be caused by birth injuries or Blount's disease, which is a pathologic type of bow legs, but it's really rare. And there's usually a family history in the patient of other family members that had to have surgery on their legs if it's caused by Blount's disease. But it shows up as asymmetry.
Okay. So, Polly, you've been working with Children's Mercy, if I'm not mistaken, for many years now, working with the orthopedic surgery team. In your experience, what are some of the common conditions that you see? What are some of those things that we're learning new things about, new treatments? Tell us a little bit more about your overall experience in the clinic that you work in.
So, our job is just to screen patients to see if they have a more complicated condition that might need to be treated by a surgeon. So even kids that have in-towing that are older because their turning in is actually coming from their hips, that's what we used to treat with braces and bow legs. But then we did studies and found out we had kids that were in braces and kids that weren't in braces. And over time, we found out that they were both getting better on their own, and so the braces weren't even helping. So that's when we stopped treating kids with braces for bow legs and in-toeing. Kids that have flat feet, we see a lot of kids because parents are concerned. But if the kids are going to develop an arch in their foot, they do it in the first decade of their life. And one of the newer things is that shoe inserts and special shoes don't have any effect on the development of the foot. So sometimes we see parents that think that their child needs a shoe insert so they won't have flat feet. But the shoe inserts don't change the structural development of their foot, so we don't recommend that. The only time we recommend a shoe insert is if, when kids are older, if they're having foot pain, a shoe insert can sometimes help with that.
And so, Polly, how many patients do you see in your clinic every week?
We see fractures too in our clinics. So we have about 50% screening patients and 50% fractures.
And when you're looking at the screening of patients, how many of them actually go on to needing surgery?
Maybe 3 to 5%.
So it's a pretty
to
low,
see,
yeah.
and not necessarily surgery, but maybe serial casting or things like that.
Okay. Is there what else would you like to teach us about, Polly? I know you have vast experience, so we've talked a little bit about the bow legs, et cetera, but is there anything else, any other common condition that you'd like to teach us about?
One of the other things that kind of goes along with in-toeing or femoral anteversion is kids will sit in the W position, and parents are always taught to not let their kids sit like that. But actually, sitting in the W position is comfortable for the kids, and it doesn't make the in-toeing worse. It doesn't affect their hips. But what I teach is to have the kids sit both ways so that they learn to sit crisscross, but they can sit in the W position so it doesn't turn into a struggle with their parents. And then by the time they're school age, they know they're still flexible enough that they can sit both ways. And that's just something that's out on the internet, that W sitting is harmful to kids, but it's not really.
Okay. Are there any other myths like that that are floating around that parents believe, that you see on the internet, that you often have to correct?
Wearing shoe wear. Kids don't need special shoes or high tops. Shoes are just to protect their feet. It doesn't affect the way they walk. Actually, learning to walk barefoot has more benefits for kids than wearing shoes. That's another common thing that we hear from parents, or that they have questions about.
Yeah, so, I guess, Polly, just to kind of summarize all this, I know you work at a very busy orthopedic surgery clinic at Children's Mercy. You have vast experience. I'd like to end just by asking, what is it you want people and general practitioners to know about common orthopedic conditions?
That in-toeing and bow legs are normal conditions of childhood that don't need to be treated with bracing or surgery, but we're always happy to see kids just to help reassure parents, and so parents can sleep at night and know that they didn't need to have special shoes or braces on their child as they grow and go through their normal developmental stages.
Okay. Well, Polly, I want to thank you for the work that you do at Children's Mercy, and definitely thank you for coming on the show today. You're listening to Transformational Pediatrics of Children's Mercy, Kansas City. For more information, you can go to childrensmercy.org. That's childrensmercy.org. I'm Dr. Mike Smith. Thanks for listening.